you for the invitation. It's a real privilege to be here and to be invited by Success. So, as Sunway said, I'm a consultant paediatric oncologist at Gosh. I'm really delighted that Morgan Daniel, our research associate, is here as well to kind of encourage networking and to let you know about our study, which is called Learning Curve, First Steps in the Development of a Co-Design Programme to Help Childhood Brain Tumour Survivors to Succeed in School. And this is the very early stages, and Morgan has just been kind of employed to roll this study out. So this is really about kind of telling you a bit about it and the background and why we think it's important. So first of all, actually none of us look like these esteemed gentlemen. In fact, we don't have a gentleman amongst us at all, but I would definitely say that it really feels like an A-team in terms of the different scope of expertise that we all bring to this project. So it started, the study is funded by the Brain Tumour Charity, and I think what's been really amazing over the last few years is this recognition of the importance of quality of life studies and about survivorship. And Brain Tumour Charity held a sandpit event to really bring together kind of experts in the field from many different kind of walks of life to try and answer this question: how can we improve the quality of life of childhood brain tumour survivors? And through that, that's how myself and then Jo Stone, who is an AMP at the Marsden, Louise, who's a CNS at Nottingham Children's Hospital, Jo, who's a SALT at Sheffield Children's, and Kate Dooley, really importantly, someone with lived experience of a brain tumour and a brain tumour charity volunteer, came together, and we really felt that one of the unanswered issues for brain tumour survivors was this interface between health and education, and how could we, in our kind of clinical walks of life, and then from Kate's perspective on the other side, it was that communication between the medical teams and the schools, and trying to have a joint up approach so that schools could understand what the impact of this brain tumour had been and how they could really provide support. And we just felt that we weren't really, there was no standardised approach. There were really good pockets of activity, but we felt that there needed to be a kind of standardised way to try and approach this. And then we were really lucky to get on board Prof. Bluebon Langner and Prof. Gibson in terms of really giving us that qualitative research expertise. We really wanted the teacher's voice in this, and so again we're lucky to have Claire Gormley, who's a specialist teacher, and Trisha, who's a speech and language therapist, both working within Brainbow, which is a neurorehabilitation service part of Addenbrooke's. And then we have also got Morgan to actually, who's mainly funded by this grant to kind of help deliver the study. So I think, it goes without saying, and I'm preaching to the converted here, that, schools are really central to children's well-being and development. And we know that children and young people spend huge amounts of time in the educational environment. But we know within that environment that survivors of childhood brain tumours face a number of challenges. And again, I don't need to outline these to you, and they're actually well delineated within the literature that we do have to show that the impact of having had that brain tumour, obviously from a cognitive perspective, can affect academic performance, but also that, children have and young people have physical, cognitive, social well-being needs, which really need to be supported as well. There's this important concept which I think gets really missed and which is different to other types of acquired brain injury, of this idea of growing into deficit, so that actually there can be cognitive decline over time, which can go unrecognised and unsupported, because people sort of think, okay, they've been cured now from their brain tumour, they look fine. Again, in terms of that concept of hidden disability, that from the outside, many of our patient population, it's not obvious of the burden of difficulties that they're carrying. We talked about self-identity and well-being, how that can then feed into peer relationships, and how therefore it's really important that adequate and the right kind of understanding, support and communication is there. And I think this quote from one of the qualitative studies which has been published is really kind of, I think, encompasses the challenge. So I wonder to what extent the school knows what difficulties may still appear. For them it's over, while it's not for him or us. We have heard all the information at the hospital, but the school hasn't. So again, about that communication gap, right? And that's the thing that we really wanted to look at. And I think there's a lot out there about what the challenges are, but there's very little about what are the effective things that we can put in place to address these challenges. And so that's why we really wanted to have a kind of novel approach. One was to have a focus on children with brain tumours, because there's a reasonable amount and research ongoing about children with cancer going back into the school environment and readjusting post that diagnosis and treatment. But actually the needs of brain tumours are unique and different, and especially that idea of sustained support over time and how that need profile can change. So that brings us on to the kind of looking beyond just the re-entry about the whole entire education trajectory. We really wanted, because again, it's limited in the literature, the voice of teachers, because we realised that we were just coming from one perspective. We're trying to send out information. The families are telling us the things that are happening, but a lot of the time the things that aren't, or that the teacher has got the neurodevelopmental report, but those recommendations haven't been put into place, the frustrations that families have for that. But we really don't know what are the challenges on the other side, because we know that teachers are working under huge amounts of stress and with lots of different competing needs within their class of 30 or whatever it may be. And so we really wanted the perspective of all stakeholders so that we could get a common ground, and we wanted to then develop that as a foundation for the development into a national programme. So that would be our ambition. This is clearly the first steps of that. So that led us on to successfully getting this award, which is a project over an 18-month period with a research question looking at both the barriers, which we know exist, but also the facilitators. So we know that there are, as I said, pockets of really good practice. We know that there are things that work well. We know that there are workshops being led, for example, to try and educate teachers, but we know that that's not nationwide. We also know that some schools are doing an incredible job at supporting children and young people, but we know that others really aren't. And we just wanted to understand what are those barriers and facilitators. And that was the really important bit in this, is this idea of continued achievement and the fact that it is a trajectory from primary to secondary to further education as well. And we're really hoping that these findings from this project will then lead into the co-design of a national programme. So I'm sorry if it's probably a bit small for you at the back of the room, but just to give you a flavour of what our methodology is and what the project will look like, it will have three main work streams. The first is really a scoping exercise to kind of identify those existing programmes. We know that there are, initiatives by charities such as Success and local charities, also really good practice within the centres looking after children and young people with brain tumours. So we want to kind of really understand what that is, because we actually don't have a clear picture. And that will be starting off with a sort of desktop exercise and follow-up telephone calls that Morgan has already started. So if you are aware of good practice or what's been happening, please do get in contact with us. The second, which will be a really major part of this, is understanding the voice of the stakeholders. So as I said, that would be the children and young people themselves, so age 8 to 25. Parents of children and young people up to the age of 25, that experience of a child or young person who's had experience of brain tumour in education, teachers, and then obviously healthcare professionals. And we've changed the word teacher actually to educationalists to also encompass, for example, educational psychologists. And we will start by having a questionnaire and analysing those results, and then move on to some targeted interviews as well. And then the last bit, the work stream 3, is a stakeholder workshop to use all of that really rich, what we're hoping is going to be really rich data, to bring in some key stakeholders and inform the development of what a national programme might look like. And we really want this to be collaborative and co-designed. And that will use the attention to those barriers and facilitators that we've identified in the first 2 work streams. So I'm just going to end by saying, what we really want to hear is the voice of everybody in this room, because we know that it really makes a difference. Our email is there, so please do get in contact. We're still putting everything to go through ethics, etc., to get started with the questionnaires and surveys. So that's going to take a few months, but certainly that scoping exercise is really live and underway. And I don't know, Morgan, if you wanted to add anything to that.
Yeah, so like Sarita said, we're still going through the process of ethics, which I'm sure if people in the room have had to do that, it's
painful.
It can take a while. But we're trying to get that through as quickly as we can and get set up as soon as we can to start interacting with our stakeholders. So if anybody here knows a child or young person who might be interested in speaking to us, we've got different recruitment sites. Hopefully we'll be able to reach a lot of children and young people. If anybody here is a parent of a child or young person between the ages of 5 and 25 who has experienced brain tumour, or anybody knows any teachers, healthcare professionals that are interested in talking to us, and specifically any good programs out there or any good resources out there that anybody knows of, then please do get in touch, because although recruitment might not start for a little while, you can contact us and I will be able to kind of keep that for reaching out to you in the future. But we also, I think, want to get a look at what's going on not just within England as well. I think that's quite important. We're wanting to find out about what's going on in other parts of the UK as well, because there may well be good initiatives taking place in Scotland, Wales, Ireland. We would want to get a picture of what's going on across the whole of the UK. So any information at all, please do get in touch with me. I'd really appreciate it.